9 best or worst foods for your pancreatitis pain. Pancreatitis is a painful condition where your pancreas becomes inflamed, causing a lot of discomfort. This small organ tucked behind your stomach plays a big role in digestion and managing blood sugar. When it's upset, you feel it. The foods you eat may directly impact how severe your symptoms are. Some foods soothe the pancreas, helping to ease your pain and speed up recovery, while others may make things much worse, causing more pain and problems. Choosing the right foods may be a bit tricky. It's important to know which foods are your friends and which ones are foes, especially when dealing with pancreatitis. Watch today's video, and we will tell you about the best and worst foods for dealing with pancreatitis pain. But do you actually understand what pancreatitis is? If not, then stay with us till the end to find out. Best foods for pancreatitis pain. 1. Cruciferous vegetables. Cruciferous vegetables like broccoli, cauliflower, Brussels, sprouts, and cabbage are renowned for their health benefits, particularly in reducing inflammation, which is key in managing pancreatitis pain. These vegetables are packed with a powerhouse of nutrients, including vitamins, minerals, and antioxidants, that collectively play a crucial role in soothing an inflamed pancreas. The anti-inflammatory magic begins with glucosinolates, compounds found abundantly in cruciferous vegetables. When you chew these vegetables, glucosinolates break down into biologically active compounds such as indoles and isothiocyanates. These compounds may help to reduce inflammation in the body. They do so by inhibiting the activation of inflammation pathways in the cells, effectively telling the body to take it easy on inflammation, which is a common response in pancreatitis. In one study, 40% lower odds of pancreatic cancer were associated with the highest level of raw cruciferous vegetable intake among the entire study sample. In terms of daily intake, aiming for about 1 to 2 cups of cruciferous vegetables per day may be beneficial. This amount is enough to provide anti-inflammatory benefits without overloading the system. It's also versatile enough to be incorporated into meals, whether steamed, roasted, or raw in salads. Additionally, for those with thyroid issues, excessive consumption of cruciferous vegetables might interfere with thyroid hormone production. They may block iodine absorption in the thyroid gland. 2. Blueberries and cherries. Blueberries and cherries are not only delicious, but also potent in managing pancreatitis pain due to their high antioxidant content. The primary agents in these fruits that tackle inflammation are anthocyanins, a type of flavonoid that gives the fruits their vibrant colors. When you consume blueberries or cherries, anthocyanins are absorbed into your bloodstream, where they begin their work. They target inflammatory processes by neutralizing free radicals, unstable molecules that may damage cells and tissue, thereby exacerbating inflammation. By scavenging these free radicals, anthocyanins help protect the pancreas from further damage, which is crucial during pancreatitis. Furthermore, anthocyanins help modulate the inflammatory response by inhibiting certain enzymes that produce inflammatory markers like cytokines and prostaglandins. By reducing these markers, blueberries and cherries may effectively decrease the overall inflammatory environment in the pancreas, which helps alleviate pain and promote healing. For daily intake, about 1/2 to 1 cup of these berries each day is generally recommended. This quantity is sufficient to leverage the anti-inflammatory benefits without overloading on fructose, which is the natural sugar found in fruits. However, While there are numerous benefits, there are also some considerations to keep in mind. For individuals managing their sugar intake, especially those with diabetes, the natural sugars in blueberries and cherries may affect blood sugar levels. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Whole grains, brown rice, quinoa. When managing a condition like pancreatitis, it's essential to support the pancreas by minimizing stress and inflammation. Whole grains are equipped to do just that through several mechanisms. First, whole grains are a significant source of dietary fiber. Fiber helps the digestive process by controlling the release of hormones and digestive enzymes, including those made by the pancreas. This regulation means that the pancreas isn't overstimulated to produce excessive enzymes, which may aggravate inflammation when you have pancreatitis. Additionally, fiber helps stabilize blood sugar levels. Stable blood sugar means the pancreas doesn't have to work as hard to produce insulin, which is beneficial since overworking the pancreas may exacerbate inflammation and pain. However, potential downsides should be considered. For individuals with compromised pancreas, fiber content may inhibit pancreatic enzymes. Although it may be helpful in some cases, professional intervention is advisable. In one study, women who ate the most whole grains were least likely to die from inflammation-related chronic conditions. Thus, it may help with pancreatitis too. Furthermore, whole grains like brown rice and quinoa are packed with B vitamins and magnesium. B vitamins are crucial for energy production and the proper functioning of the nervous system. It may help the body cope with the stress of managing chronic conditions like pancreatitis. Magnesium acts as a natural calcium blocker, which helps to relax the muscles and may reduce the tension in the pancreatic ducts. Thus, it may ease the flow of enzymes and bile and reduce pain. The recommended daily intake of whole grains may vary based on dietary needs, but generally, incorporating about 3 to 5 servings of whole grains per day may be beneficial. A serving might look like a half cup of cooked quinoa or brown rice. This amount helps to maximize the benefits without overwhelming the digestive system. 4. Lean meats, chicken, turkey. In humans, prolonged exposure to a diet rich in protein and fats may alter enzyme levels in the pancreas. It may help in some cases. Lean meats, such as chicken and turkey, hold potential for reducing pancreatitis pain due to their low fat content and high-quality protein. Protein is vital for repairing and maintaining body tissues, including the pancreas, but the type and amount of fat consumed are equally important because high-fat diets may overburden the pancreas. When you consume lean meats like skinless chicken or turkey breasts, your body may benefit from their high protein content without the added stress of excessive fat. Proteins in these meats may help in the rebuilding of pancreatic tissue that might be damaged due to inflammation. Moreover, because they're low in fat, these proteins do not require the pancreas to work overtime producing digestive enzymes, which is often a trigger for inflammation and pain in pancreatitis. Additionally, lean proteins provide a feeling of satiety without contributing to elevated levels of triglycerides in the blood, a condition linked to pancreatitis. Keeping blood triglyceride levels low is crucial because high levels may increase the risk of developing pancreatitis or worsen existing conditions. Generally, aiming for about 800 milligrams of protein per kilogram of body weight is suggested. However, overconsumption of lean meats may still lead to higher levels of saturated fats, which could potentially stress the pancreas if consumed in large quantities. 5. Turmeric. Turmeric holds powerful anti-inflammatory properties that are particularly effective in managing pancreatitis pain. The magic ingredient in turmeric is curcumin, a compound that provides both the distinctive yellow color and numerous health benefits. The process by which turmeric reduces pancreatitis pain may begin when curcumin is ingested. Once in the body, curcumin acts on a molecular level to block chemicals that promote inflammation. Specifically, it inhibits the activity of NF-κB, a protein complex that may play a crucial role in triggering the inflammatory response involved in many chronic conditions, including pancreatitis. By preventing this protein from activating genes related to inflammation, turmeric may directly reduce the inflammatory processes that exacerbate pancreatitis. Regarding daily intake, incorporating about 500 to 2,000 milligrams of curcumin in supplemental form is considered safe and effective for most adults. While turmeric and curcumin supplements are generally safe, they do come with potential downsides when consumed in high doses or without proper guidance. For instance, high doses of curcumin may cause gastrointestinal issues like diarrhea, nausea, and indigestion. 6. Fatty fish, salmon, mackerel. Fatty fish like salmon and mackerel may help in reducing pancreatitis pain due to their rich omega-3 fatty acid content. These essential fats are known for their robust anti-inflammatory properties, which are vital in managing conditions like pancreatitis, where inflammation is a primary concern. When you consume fatty fish, the omega-3 fatty acids, specifically EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, are absorbed into your bloodstream. These fatty acids may work by disrupting the production of inflammatory molecules called eicosanoids and cytokines, which are typically triggered during inflammatory processes like those seen in pancreatitis. By inhibiting these molecules, omega-3s may help reduce the overall inflammatory response in the pancreas. Furthermore, these fatty acids may also improve blood flow, which enhances the delivery of nutrients and oxygen to the pancreas, aiding in its healing and reducing potential damage from inflammation. Studies suggest that the consumption of total fish, fatty fish, and lean fish combined may be associated with a decreased risk of non-gallstone-related acute pancreatitis. The recommended daily intake of omega-3 fatty acids isn't one size fits all, but a general guideline suggests consuming at least 2 servings of fatty fish per week. One serving is approximately 3.5 ounces of cooked, flaked fish. This amount is sufficient to garner the anti-inflammatory benefits without overloading your system. However, there are some potential downsides to consider. Consuming large amounts of fatty fish may lead to an intake of too much mercury, a toxic heavy metal found in many types of fish, especially larger and older fish. Now, you know the foods that may help your pancreas recover from damage, but you also should learn the worst foods that are escalating the problem without you realizing it. Here are the worst foods for pancreatitis pain. 1. Alcohol. If you consume alcohol, your doctor will recommend that you stop drinking after being diagnosed with pancreatitis. Consuming alcohol may make pancreatitis worse, so to protect your health, you'll likely be advised to avoid alcohol completely. The process starts in the liver, where alcohol is metabolized. One of the byproducts of this metabolism is acetaldehyde, a toxic compound that may damage pancreatic and liver cells. Moreover, metabolizing alcohol requires the liver to produce more enzymes. Some of these enzymes may spill over to the pancreas, leading to an excessive enzymatic reaction in the pancreas itself. When these enzymes accumulate in the pancreas, they may start digesting pancreatic tissues. This autodigestion leads to inflammation, swelling, and even necrosis, death of pancreatic tissue, which significantly increases pain. Additionally, alcohol may cause the small blood vessels in the pancreas to swell, leading to decreased blood flow. This reduction in blood flow may exacerbate the damage to pancreatic cells by depriving them of necessary oxygen and nutrients. 2. Red meat and processed meats. The process starts when red meat and processed meats are consumed. These foods are rich in saturated fats and certain proteins that may stimulate the pancreas to produce and secrete large amounts of digestive enzymes. Normally, these enzymes help break down food in the small intestine, but if produced excessively, they may begin to digest the pancreatic tissue itself, leading to inflammation known as pancreatitis. Additionally, processed meats often contain chemical additives like preservatives and artificial flavors, which may trigger inflammation in the digestive system, further aggravating the pancreas. These meats also typically have high levels of advanced glycation end products, AGEs, harmful compounds formed when food products are cooked at high temperatures. AGAs may increase oxidative stress and inflammation in the body, particularly affecting sensitive organs like the pancreas. In a study, eating red meat was associated with an increased risk of chronic pancreatitis. In addition, people who ate more saturated fat and cholesterol, and foods high in these nutrients, such as red meat and eggs, had a higher risk for gallstone-related acute pancreatitis. 3. Fried and greasy foods. When you consume fried and greasy foods, your digestive system must work overtime. The pancreas, in response to the influx of fats, releases a large quantity of digestive enzymes. These enzymes are essential for breaking down fats into smaller molecules that the body may absorb. However, in the case of pancreatitis, the process may go awry. If the pancreas is inflamed or damaged, it may not be able to handle the sudden demand for enzyme production efficiently. This may lead to enzymes activating prematurely while still in the pancreas, rather than in the small intestine, where they normally become active. This premature activation may cause the pancreas to start digesting itself, leading to increased inflammation and pain. Another issue with fried and greasy foods is that they are often rich in trans fats and saturated fats, which are particularly difficult for the body to break down. These fats may lead to the formation of fatty acids and cholesterol, which in turn may contribute to the development of fatty deposits in pancreatic ducts, hindering the flow of enzymes out of the pancreas and worsening inflammation. In the Western world, gallstones are the leading cause of acute pancreatitis, causing up to 40% of cases. Eating a diet rich in fried and fatty foods may increase your risk of developing gallstones. Thus, it may increase the risk of pancreatitis pain too. Let's learn more about pancreatitis. Pancreatitis is an inflammation of the pancreas, a crucial gland located behind the stomach and next to the small intestine. The pancreas has two main functions. It produces enzymes that help digest food in the small intestine, and it releases hormones such as insulin and glucagon, which regulate blood sugar levels. The issue with pancreatitis arises when the digestive enzymes that are normally inactive until they reach the small intestine start to activate prematurely while still in the pancreas. This premature activation leads to the enzymes digesting pancreatic tissue itself, causing inflammation, swelling, and sometimes infection. The damage may range from mild to severe and may lead to a variety of health complications. Pancreatitis is categorized into several types based on its causes, symptoms, and duration. 1. Acute pancreatitis. This type of pancreatitis occurs suddenly and usually resolves within a few days with treatment. It may range from mild discomfort to a severe, life-threatening illness. Gallstones or heavy alcohol use are the main causes of acute pancreatitis. Symptoms may include severe abdominal pain, nausea, vomiting, fever, and a rapid pulse. Treatment typically involves hospitalization, where the patient is given fluids, pain relief, and sometimes antibiotics. 2. Chronic pancreatitis. Unlike acute pancreatitis, chronic pancreatitis develops over many years and does not resolve by itself. It leads to permanent damage to the pancreas as the inflamed pancreatic tissue becomes scarred and ceases to function properly. Chronic pancreatitis is often the result of prolonged alcohol abuse, genetic disorders, or a complication of acute pancreatitis. Symptoms may include ongoing abdominal pain, diarrhea, and weight loss. This form may lead to malnutrition, diabetes, and an increased risk of pancreatic cancer. 3. Hereditary Pancreatitis. Genetic mutations are what cause this uncommon form of pancreatitis to run in families. Symptoms may start in childhood and often develop into chronic pancreatitis. People with hereditary pancreatitis have a significantly higher lifetime risk of developing pancreatic cancer compared to the general population. 4. Autoimmune Pancreatitis. The immune system attacking the pancreas is what causes this type of chronic pancreatitis. It may be associated with other autoimmune disorders such as inflammatory bowel disease or primary sclerosing cholangitis. Autoimmune pancreatitis often responds well to steroid therapy, which may relieve symptoms and restore some pancreatic functions. 5. Necrotizing Pancreatitis. This is a severe form of acute pancreatitis where portions of the pancreas die necrosis due to inflammation. It may lead to serious complications, like infections, and may require surgical intervention to remove the dead tissue. Necrotizing pancreatitis is more likely to lead to hospitalizations, surgeries, and a higher risk of mortality. 6. Idiopathic Pancreatitis. In some cases, the cause of pancreatitis is unknown. This is referred to as idiopathic pancreatitis. Even after extensive testing, no specific cause is found, making treatment and management challenging. Each type has its own treatment approaches and management strategies. Treatment may involve dietary changes, pain management, and, in some cases, surgery. Chronic conditions, in particular, require ongoing medical care and lifestyle adjustments to manage symptoms and complications. Managing pancreatitis pain involves careful attention to diet. Add anti-inflammatory foods that are easy on the pancreas. Also, avoiding high-fat and processed foods may make a significant difference in managing this condition. Always consult with a healthcare provider before making any major dietary changes, especially when dealing with a condition like pancreatitis. In this amazing video, we learned about all the best and worst foods to deal with pancreatitis pain. But did you know that there are other foods in your pantry that may offer multiple health benefits? Want to find out more? Watch 10 health benefits of eating pistachios, or watch 11 benefits of eating coconuts daily. Watch one, or even better, watch both. What other foods do you think may help ease pancreatitis pain? Let us know in the comments below.